What's up, everyone? Welcome back to another episode of Finding the Fantastic. I'm your host, Colleen D. Tiberius Shoemaker, and this is the time where we talk about social and emotional intelligence, right? We talk about authenticity. We meet some really fantastic, authentic people in our lives or who are doing really cool, life-changing things. And that brings me to my friends here. I'd love for them to introduce themselves and share with everybody what you're doing, which is cool.
Yeah. My name's Dr. Sherry Kokendorfer.
Hi guys, I'm Dr. Anusha Khan.
Yeah, and we have started a practice together called Mosaic Theory MD that we were kind of sickened and disheartened by the current medical system out there, and we wanted to create a space where we could have relationships with our patients, actually get to know them, spend time with them, and, make a difference in their life by making them healthier and live longer.
Yep, and the way we've done that is that we don't care if people have insurance or not, that our practice does not bill insurance at all, and because of that, we're actually able to make care a lot more affordable. We are a membership-based practice, and no, we're not concierge, but we are making concierge level of care affordable for everybody. So something as low as $113 per month, we're able to give you unlimited visits, no copays, no deductibles, same day, next day visits, minimal to no wait in the waiting room, and we do wholesale costs for labs, imaging, and prescription. So it's kind of like the Costco of medical care.
I love that. And okay, so I think this is really cool. We've had conversations. First of all, we're eating, squad, because we're normal human beings, right? This isn't a fancy schmancy professional whatever thing. We're authentic, right? This is life. And I met them and I talked to them and I was like, okay, you're doctors. Let's be real here. And it's terrible as someone who wants to break stereotypes, right? Yeah. And you all know I hate stereotypes. But I stereotype doctors. Yeah. I'm going to be very honest with everybody here. Like, my perception of a doctor is like one that's like, okay, I'm going to this waiting room and then I'm going to go sit naked on a chair and wait for you to come in, check your boxes off the list. God forbid I'm too fat and I get the obesity receipt, right? And it's like, it's almost like hiring a cleaning person to clean your house. Like, you want to clean your house before you get a cleaning person.
Yep.
For me, It's like, okay, I'm not going to the doctor until I know I'm healthy to go to the doctor because you guys scared the crap out of me, right? Because of this stereotype, which part of it is true. Yeah. I think I could be wrong. You can help me with that. And part of it is me putting that on you. Yeah. So, first, talk to me about this concept that you guys, first, is there that stereotype?
I think that there is, that it comes off that people are almost afraid to open up to you, that you're somehow distant and that you don't really see them. Mm-hmm. It's like you're looking past them and that you're just seeing all those things, the boxes, like you said, like I see this diabetes, I see the blood pressure, right. I see the obesity, that I don't see Colleen, or not that you have those things.
No,
but you
true.
get what I'm saying, you know, of seeing you. And that's what, we went through this whole process for this, it's a second career for us. It's not just something that we kind of fell into. It was a deliberate choice. And we really want to help people, we want to be...
But I think the perception is out there because the problem is you answer to a man. Not like literally a man, but you know what I mean.
Oh, yeah.
You answer to the man.
We all know about the man, right?
The man.
You answer to the man because you're no longer in charge. Mm-hmm. More often than not, actually now more than ever, more physicians are employed than actually operating as independent practices.
Which blows my mind because, first one, the fact that I'm eating Chipotle with some doctors, this is something I never thought I would do. Again, because of the stereotype. That's not fair to you guys. You guys are human too, right?
Yeah, and that's exactly what I was going to say, that, we go through 10 years, even more worth of training to become what we've become, only to then be, perceived as checking boxes and seeing you for 5 minutes. Because you know what? Let's call a spade a spade. That's true. That's exactly what ends up happening. But that's what's causing moral injury to our profession. So...
Okay, I gotta pause you on that just because they brought up moral injury to me, which blew my mind, okay? One, I just want to circle back to the concept you were hitting on where most physicians are employed versus, and excuse me, I don't know the terminology, owning their own practice, right? So it's like back in the day, you call your doc up, they're like, yo, I got you, I know you, I know your health history. If you've watched Downton Abbey, the mom chose the right doctor and the dad chose the wrong doctor. Anyways, But you're right. A
Yeah.
lot of doctors are talking about that and like
Yeah.
how that plays into things.
Absolutely. And so that's exactly true. That back at, actually, let me say this first, and I think things are kind of going to fall into place then. No lawyer is allowed to be employed by a non-lawyer, meaning no lawyer can work for a non-lawyer
No way.
because of conflict of interest, right? No corporation can somehow,
But a doctor can?
but a doctor, can.
That's my help.
Exactly. So think about incentives.
Sued, heart attack, sued, heart attack.
And-
Kind of the same thing.
Yeah.
So it's about incentives, right? That if I'm working for a corporation, their incentive, just like it should be. I mean, a corporation is there to make money.
Yeah.
Nobody's doing anything
Yeah.
nobody's trying to be evil per se. It's
Mm-hmm.
more of if you're going to hire a businessman or a woman to run your corporation, their job
They're
is
gonna
to
make you
bring in
money.
more money,
Right.
right?
Nothing wrong
So-
with that. Everybody needs money, right?
Right.
Yeah.
So, but if you're in the business of medicine and you've now employed physicians and you're expecting them to take care of people's health, which is the nearest, most dearest thing to anyone, right?
Mm-hmm.
But now the incentives are malaligned, right? The business person up here that owns the practice technically or owns multiple practices that you're part of, they want to generate revenue.
That money,
right?
yeah.
Exactly. So the whole idea of patient and doctor relationship kind of gets kind of murky in the middle.
Yeah.
So that's why the idea of if physicians being employed by someone who's not a physician on top of that, it's the incentives are malaligned. The incentive is to make money for that corporation, not necessarily do well what's good for the patient.
So, and you're right about a good segue for this
Yeah.
because now we're going to talk about, was it moral
Injury.
Moral injury.
Yeah.
Okay, and they brought this up to me. So again, I'm just going to be very honest and transparent here, and I know most of y'all out here think the same way I think for the most part. I don't know, I'm a little weird, but it's fine. When it comes to a doctor, again, I've got this stereotype and perception of, yeah, you're employed by a corporation, you became doctors to make a lot of money, so you're just making your money, you don't really ultimately care about me. Newsflash, totally wrong. That was a huge judgment stereotype by me, which I apologize for you guys for, and I apologize to other doctors out here because they brought this up because they're humans too. Let's not forget these are diverse, unique, beautiful human beings who are doctors, who literally went the extra mile to help people's health. Talk to me about moral injury and tell them what it is and then how it applies to like you all.
Yeah. No, it's actually quite rampant, and if anything, if no other time after this last year, it's been even more highlighted. So what is moral injury? It's basically, I'll give you an example of what happens, and then it kind of will fall into its place. You spend so much time becoming what you become, right? Minimum 10 years, maximum sometimes even 15, 16 years, depending on what your fellowships and
good
trainings
Lord.
are. Yeah. Point is that you care so much about the field that you're studying, that you want to help people so bad, that you do sacrifice yourself, your time, being away from family. There was a time that I hadn't seen my family in like months, and you're overworked, but you do that because you're working for a cause, right? Then you get into the real world. What's the real world?
We all know about the real world.
You get into the real world and you realize that you have 5 minutes with a patient. You are being told that there's 10 people waiting on you. You need to see X amount of people to bring in revenue. Yet you see this person in front of you. You know they need, whatever help as far as mental health is concerned, their biological health is concerned, and you're expecting them to be fixed in 5 minutes because now you have, a bunch of people waiting. You go home feeling like I could have done so much, but I'm asked by the man to make sure I see 30 patients so the practice can do well. But you're thinking of the 10, 20 people that you saw, they could have done so much for, and that you want to do more for, but you can't. That causes moral injury, meaning your morals and what you're doing are clashing. And now more than ever, in our profession especially, suicide rates with doctors is skyrocketing.
This blew my mind, everyone, because you guys know I openly talk about suicide, suicidal thoughts, everything. We are normalizing that conversation. Blew my mind because, again, my perception, my stereotype of you guys, which I'm so sorry about, was just, you thought, this is terrible, but I'm just going to say it.
No, please.
You thought, you guys believe you are this higher intelligence, worked harder than everybody, make a lot of money people, therefore you're checking off the list. If you saw your people, made your money, check to go home. And that is so judgmental of me and ignorant, because if I stop and I think about it, I guarantee you the majority of people who have gone into the health field don't go in the health field to say, I'm going to make a lot of money. They go into the health field because they go, I want to save lives.
Right.
Yeah.
Because this is the thing. If I wanted to make money, I could have done so many things for a fraction of time.
Yes.
And I would have actually been
Yeah.
making more money than I do now.
Then now.
Yes.
So
Yeah.
people, and this idea of, doctors are rich. And you know what? I don't take away from the fact that some are. Let's call
You work for it. Yeah, you work for it.
Let's be
It's like
real
any
about
other
it.
profession that you work for it
Right.
for.
But
Yeah.
exactly.
It's just worse on you guys, which blows my mind too,
And which sucks because, especially after the last year, I mean, we're almost hated.
Yeah.
Nobody
Yeah. Oh,
wants
yeah.
to hear from
Yeah.
us. No, and it's like, but we've been through the thick and thin of it. We've worked side by side with other healthcare professionals. We learn from them. There's a ton of information that you pick up from your peers that are not necessarily doctors. They're nurses, they're PT people, they're OT people. These are, supporting staff that actually help create that team that gets you to that goal, right? But then you hear all this, negativity and this, idea, well, it's the doctors that are causing the increase in, healthcare prices, this and that or whatever, because we're the face of medicine. So you want to blame the face of the medicine. And this is not...
When it's the man who's trying to make the buck, right?
And it's because the healthcare industry has become a industry that's corporatized and wants to make money.
Yeah.
And that's not to say that let's start, pointing fingers
No.
or whatnot. that
Pointing,
we're free-
pointing fingers never solves
Yeah.
anything.
It never solves anything. So what you want to do is, okay, well, if the current system isn't working, can we do something different?
I love that. Have you ever read the book Blue Ocean Strategy?
No, but I'll look
Okay,
it up.
read the book Blue Ocean Strategy. It's the concept where the industry you're in is oversaturated. All right, it's flawed. It's oversaturated. What can you do in your industry to create a new blue ocean out of the red bloody ocean you're in?
That's
What you guys have
amazing.
done with this is created a blue ocean,
Yep.
which is stellar. So, doctors' suicide rates are high. I want, for those watching this right now, to hear that again. Doctors' suicide rates are high. Moral injury is a very real thing, right? So, I think it's cool because right now we're breaking stereotypes because we're having a conversation. Like I said at the beginning of this, we're eating Chipotle together. We're having a conversation. This is the longest I've probably spent talking to doctors in my life, right? And I mean, no offense to the doctors out there who I've seen, because now I know you're under a lot of pressure, right? So, I have a couple questions.
Sure.
Question number one, how is somebody who maybe doesn't live near you guys or couldn't, let's start with the community. Can the community just come up and start talking to you guys and be like, hey, can I just talk to you about things? Like, are you open to that? What does that look like?
Yeah, I think for us, that of course we have, lines that we have to draw as far as like direct medical advice. But as far as being a resource for people out in the community, that we're someone that you can engage in conversation, about your health or resources out there, we want to be those people for you.
Cool.
'Cause again, it's what we got into this for.
Well, not only
helping
that,
people.
we actually, as of the last, I want to say 3 times, and it's happening again this Saturday, we were one of the vendors at the farmer's market.
Oh, that's cool.
So we wanted to go
That's
see
awesome.
people
Yeah,
at the,
meet them where they're at.
meet people where they're at.
And they're
exactly.
super open, by the way, because I never would have gone up to talk to you guys. This is terrible. I'm terrible. I am my own person I talk to,
Yeah.
but at least I'm admitting it and overcoming it. I wouldn't have talked to you because I wouldn't have thought you're mean or anything, but I wouldn't have talked to you because I would have thought you would have looked at me and been like, well, you need to book an appointment, right? Because of society's check
I see what
boxes,
you're
right?
Yeah.
No, man, these 2 women came up to me and they were like, hey, how are you? And I'm like, whoa, they're small business owners. Let's just not forget that
Yeah.
either. We're part of the community, right? Okay, so the community can chit chat with you guys. What about people who are, I have listeners all over the nation and also like in Australia and stuff. What about people who, I mean, you guys are here to help people's health. How can they get a hold of you in terms of that? Can they just message you, email you, all the stuff?
So, if you're an existing patient at the practice, absolutely.
Mm-hmm.
People get our own actual phone number. So, with urgent things or with after hours or weekend stuff.
Like the
other-
old school doctor theory.
Exactly, that you're accessible rather than worrying about, oh, do I need to go to the ER?
We all know
or-
stuff happens on the weekends. It all
Always.
happens on the weekends.
Always.
Like, for example, we always say when we were in, when we're at the hospital that heart attacks always happen in the middle of the night.
Mm-hmm.
They never happen at like, and on a holiday.
Or no,
Yeah.
holiday. That's a
On
fact.
holiday.
Yeah.
I agree.
So point is that you don't want your patients to be stranded in the sense that it's the weekend or it's the after hours. Okay, well, do I go to the ER? Do I go to the urgent care? It's kind of nice to have somebody in your back pocket where I always give a example of a family member. If you had a doctor in the family, that'd be the first call you make, right?
Oh, hands down. Oh, I always look for my inner group, and I'm like, who do I know that I can call?
Exactly.
Yeah.
And that's exactly what we've created, where we want to be that doc in the family, where
Cool.
your first call is to us. If it means that you need to go to the ER, you need to go to the ER.
Yeah.
But you got that information filtered through somebody who knows that, okay, what are the things that I can handle, and what are the things that need ER or hospital help.
That's true, because yours truly went to the emergency room. I had the flu, and I probably could have survived at home a while longer, just needed water. But I went to the emergency room, and they just gave me fluid.
And they sent you home.
And I sent home with Bill. And I could have been great had I called someone and be like, yo, doc, do I gotta go to the ER?
So Colleen, to that, do you know how much that would have cost you if you were our member?
How much? Not zero. See? It didn't cost me that I had to go to the
Why?
ER.
Because the visit would have been included, and that bag of fluid that they charge you hundreds of dollars for, it's $1.
Oh my
It's
God.
$1.
It's $1.
Literally $1.
I mean, that blows my mind, but the fact that I can call you for stuff like that, you know? I mean, you have best friends, right? And you call your best friend. Like, we're at the point in society where we're looking on WebMD for stuff, right? Because there is no this. There is no open channel of communication to talk about the craziest thing, which is our health, right? And I want to jump into, I have another question I don't want to forget, but I want to jump into mental health for a second.
Sure.
Because on Finding the Fantastic, we talk about mental health a lot. We talk about depression. We talk about anxiety, things like that, right? And I'll be very honest with you. I would never in a million years think to talk to my doctor, right? My primary care doctor about my mental health. When the reality is there are certain points in time where I absolutely should probably talk to you guys about where I'm at with my mental health. You know how they ask you like in a normal checkup, they're like, so any depression lately? And I'm like, no, life is peachy keen, right? So talk to me about that.
No, and that's really, I guess, the misnomer that, we wanted to get out there to the community and let them know. We totally want to hear about those things, because of course, there's the side of it of, being a doctor that I'm looking for cues. If there's something that you're telling me that puts you at a higher risk, then I need to be more worried and protective for you, right? Because we want to protect and do no harm for our patients. Right. But there's things too that before you get to the point of, wanting to hurt yourself or worse, take your life, that we can be there for you. Yep. Sometimes for our patients, that there's other underlying problems that we can help with. So many times people with chronic illness, chronic pain, especially, that you can get depressed from that.
Oh yeah.
Right? That you can, feel like that you don't want to do anything, and that we can help with that, to talk to us.
Yeah, and I think the misconception also is, well, what is a primary going to do? You know what I mean?
Yeah.
And no disrespect to Lady Gaga, but I don't know if you guys saw this, and I don't know if it was last year or maybe even earlier than that, but she made a comment about, go seek out a psychiatrist, that your primary doesn't know what to do about it.
Oh, wow.
And she made it was such a disservice to so many people, because most people don't even have access to primary care.
Yeah.
And then second, to then expect a person to go find a psychiatrist for it.
Yeah.
It's like us being internists, we spend 3 years, after 4 years of med school, rotating through every subspecialty that makes us human. Psychiatry is one of them.
That's crazy. Did you guys catch up on that? They go through every thingamabob, I don't know the proper term, but if you think they don't know it, they had to go through it. That's what you're saying.
Yeah, exactly. And so we know where our limits are, right? That any good physician knows where their limit is and when they need to call on that subspecialist. So the cardiologist, the GI doc, the kidney doctors, we need all of them. But as internists, as adult medicine doctors, we are able to take care of up to 80% of all of those subspecialties.
Wow.
That's the whole point of becoming an internist. It's a beautiful specialty, and it falls under the umbrella of primary care as well. But in this country, unfortunately, primary care is looked upon as the dumb specialty.
Yeah.
It's not given the importance that it deserves. And in any other country, you'll notice that primary care is the foundation.
Really?
Yeah.
It is, thought of as, okay, have you seen your primary? They're the gatekeeper in the sense that they could probably take care of you. If they can't, they will refer you out. You see that consult, you come right back to them. You're a quarterback, and you're the referee.
That blows my mind because you're right. If I were like I never like going to get a physical because again, it's that stereotype and it's just the check off the list. I'm the one who will deal with pain and not go see the doctor knowing I should because I'm in extreme pain because I'm just like, they're just going to have me go get an MRI or an x-ray and I'm going to have to spend $500 and I will learn to live with this pain. But if I think about it, what you're saying, if I'm living with this pain, it's going to come up here and now the cycle of life is just going downhill, right?
Exactly.
And that blows my mind. Big question. I'm going to look at the camera for this one. If I tell you guys I'm depressed, are you going to send me to a mental institution or put a red marker next to me like I'm some kind of crazy person?
No.
Ah.
That there are triggers and like I said, those warning signs where, we want to come alongside as the healthcare system and kind of wrap our arms around you and protect you during that time. Because often those triggers, there's one thing of being depressed, having anxiety, and, even passively thinking about hurting yourself, those kind of things, not that it's normal, but a lot of people feel that way.
A lot of people, well, we've talked about this before where, and I don't know this as a hard statistic, but I firmly believe that 90% of people think about self-conclusion in some way or another, and we've talked about this a lot.
Yeah.
But it doesn't mean that you lock them up.
Yeah.
Mm-hmm.
And that, that's where we want that relationship for us. Like, we have patients come in just to talk sometimes of like.
Do you hear that? Just to talk.
Yeah. That
Because we have the time.
Yeah,
Because you have the time.
Right.
Yeah, and it's not like I can fix all of your problems, but a lot of times just verbalizing that to someone, and all of us just as human beings, as like friends, can do that for somebody of just listen.
But let's validate your feelings too, though.
Yeah.
Why do you feel that if I, describe my feelings to you, that they'll lock me up, there'll be a red flag and whatnot? It's because the system has made you feel that way, right?
Yeah.
How can you expect to come in and see a professional, whether it be, any level of clinician that you're seeing, spend 5 or 7 minutes with them, you say to them that, hey, you're having these thoughts of hurting yourself, and then them not just have this knee-jerk reaction because, well, I don't have any more time with you, so I'm going to pass you up.
911. Yeah.
And it's like the trauma that you are causing this person by then calling 911, and this actually has happened.
Yeah.
We've been told, we weren't there, and it wasn't at our practice, but it was at an urgent care center. Somebody came in and said, I'm going to hurt myself. If you don't help me right now, I'm going to do something. So the front desk person gets whoever the clinician was at that time, says to them what's going on. That clinician immediately calls 911. This person who's already traumatized is now being taken away in handcuffs.
Oh my
Handcuffs.
gosh. Handcuffs?
So let's validate that there's a reason why people feel that way.
There is.
And I want to be the first one to tell you that, yes, there are lines where if you tell me you're going to hurt yourself right now, you don't need to be taken away in handcuffs.
Yeah.
You can have an ambulance be called and they'll take you to the hospital, and then the psychiatric unit will deal with you then. Because if you're imminent harm to yourself, yes, somebody needs to do something about it, but you don't need to be handcuffed, right? But second, if you've been dealing with negative thoughts, you need to have somebody by your side that can actually A, spend time with you to let you vent it out, and then B, have this ongoing relationship with you to figure out why are you feeling this way. Throwing pills at you isn't what we do.
Yeah.
Even
Awesome.
though there is a place for
There's a place
pharmacology.
for it.
There is a place,
Yeah.
and I would agree because I'm a
Yeah.
huge
Yeah.
proponent. Like I used to take ibuprofen like it was my job, right?
Oh.
I'd pop 4 a day. I'm like, I got the joint pain.
Oh, no.
I got all that. I'd take them, right? And then I realized that you can get hemorrhoids from ibuprofen, right? You can really jack you up. And I'm like, I don't want to be bleeding into the toilet like that. I already do that once a month. And so I was like, let me stop taking ibuprofen, and I found that there were other ways that I could like help myself. I wish at that time I had a resource like you guys to where I could talk it out, because at that point I was taking care of myself. And to go back real quick to what you're saying, because I got goosebumps over it, and we talk about this on Finding the Fantastic all the time. One, if you are having thoughts of self-harm right now, if you're thinking about suicide right now, if you feel depressed and you feel like you are crazy yourself, which is part of the reason why a lot of people freak out about telling other people, because they already feel crazy themselves. You're not crazy, okay? What you need to do is talk. That is the first step, whether it is to someone like a doctor, whether it is to your support system, whether it is reaching out to me. Please, I've seen almost all of it. I've heard it. I'm sure you guys have seen probably all of it, right? And while there are extreme cases of we don't want you to hurt yourself in the moment, I've had plenty of people call me out to say, I am going to hurt myself, and I just sit and talk to them, right? And we're able to navigate through communication a different way. And what they're saying is that's what they want. We want to find a different way to help you while you're going through that. I have had thoughts, okay? And you got to talk through it. So I think that's really beautiful. And remember, this is something I have to keep reminding myself, they literally went into the medical field to help people, not to check off a box, not to send anybody away, but to help people. So you want to help us, right? So as a community right now, if you're in the near area to us, we're in Sterling, Virginia, reach out to them, come see them, and not for sake of business and money, but for sake of your health. We care about you. All three of us, we're on the phone, agreed, we love people. And we don't want to see people hurting, and we don't want to see people kill themselves, like any of that. We want to help you, right? Yeah. So we're a resource for that. Yeah. Look at you got 2 doctors. Okay, I'm not a doctor. I'm just someone you can talk to, right? And I like to talk.
No, but that's the thing too, right? Yeah. Cognitive behavioral therapy. There's a lot of things that we probably don't know how to retrain somebody to think about their thoughts differently. Our cognitive behavioral therapist colleagues are really good at that. And so, we know what our limitations are. We can absolutely sit down with you, talk you through a lot of things, but there's a point in time where I know, okay, you need somebody that can give you resources to retrain yourself to kind of think of things differently. So our job is to then also give you those resources, right?
Yeah, and to facilitate that, because sometimes that you don't know where to look in the community of how to reach out, and that we can help with that. We can come alongside you and be that resource for you, and that as Dr. Anusha said, that we want to be that for people. We want to be that person that you can call no matter what time and talk through it, rather than do something drastic. Because so oftentimes it's a temporary kind of just impulsive kind of act, and that if you can get that support during that time, then you don't follow through on it, right? And then we can set you up with other things down the road of these resources, a plan in place if these thoughts come back, of reaching out to us, of a friend, someone in your faith community, of having these resources, things even as simple, if this is something that you've thought about in the past, of let's make a detailed plan of let's get rid of things in your vicinity that you could use to do that, of things like that, a checklist that we can kind of go through with you and be a resource, and then hand you off to, maybe a different level, higher level of care to get that kind of coping mechanism training that can help you deal with these as you go through life.
At the end of the day, you're not alone.
Yeah.
That's all we're trying to say.
I love that.
Yeah.
But, okay, I want to talk about on the lines of having people who care and open communication, and I'm going to talk from my history. There was a time I convinced a doctor to put down that I was allergic to an antibiotic called Augmentin. All right. And this is an example that I think you guys are breaking down these stereotypes, but people are out there suffering, okay? So, I got on an antibiotic Augmentin, and I had a yeast infection for a month, okay? And to all my women out there, right, if you've had it, it's horrific, okay? And anyways, I spent like over $200 on the Monistat. I even got the Jockish spray. That's a whole nother story, but don't do that. That's for men, not for women.
Please don't.
Don't do that. But my point is, for a month, I'm in pain, okay? I'm spending money trying to figure it out. Well, it finally heals up, and like a year later, I go to another doctor, because again, I doctor hop, and he's like, all right, you need an antibiotic, I'm going to put you on Augmentin. I said, no, sir. He's like, well, are you allergic to medication? I said, Augmentin. And he goes, oh, well, what happens to you? And I'm like, I don't really know what the medical, allergic reaction is. And I was like, sir, I get a yeast infection. He's like, well, that's not really an allergic. I said, no, sir, yes, it is. I get a yeast infection. I told him about all the what I had. I gave him all the gory details, right?
I live like this.
So I get to convince him to put Augmentin as a thing. And then again, a year later, I go to a different doctor. Because again, I doctor hop is what I do. I don't have a communication. Nobody really has Colleen's medical history, okay? They're all over America. And the doctor says, oh, I see you're allergic to Augmentin. I'm like, yes, I am. Yes, ma'am, I am. And she's like, so what happens? Like, what is your reaction? I'm like, I have got to research what the reaction is to Augmentin. So I have to fess up that it's because I get yeast infection. She goes, oh no. She goes, that's not an allergic reaction. She goes, I can give you a pill that will help with this.
Yeah.
And I'm like, wait, what? She's like, it'll take care of it in like 24 hours. And I'm like, oh my God.
One day.
Yeah. So like, talk to me about.
Not $200 a month.
Right, $200 a Monstat. Same thing happened with a UTI. It's like, of course, we talk about things happen late at night. It's like 1 o'clock in the morning, and I have a UTI. I didn't know at the time, but I knew it at the time. We all women, we know this, right? Talk to me about, like, I mean, you have a setup to where I can just call you, right? Or text you, right? What does that look like?
Yeah.
To all the girls out there who suffer, listen up.
Yeah,
listen up.
and it's a great thing with, women, because, again, in that relationship too, but, for the diagnosis of UTI and treating women, that it's all about symptoms. So you can call me up, past office hours, weekend, whatever it is, and tell me what's going on with you. And I can send a script. It doesn't have to be this long, drawn out, oh, I got to get time away from work.
Right.
I got to set this up. I got to do this. Like, life is busy, but...
Right.
Because the biggest thing is if
Yeah.
I know you as a patient already,
Yeah.
I know your past medical history. I know what you're allergic to and what you're
Yeah,
not allergic
what
to.
you're not allergic
Guys,
to.
I
just,
know,
yeah.
I know, whatever past medical history you have and what could be, causing these recurrent UTIs, for example, or what kind of medication would interact with stuff that you're already on. I already know that, right? Because you're my patient. So say on a Saturday at 1 o'clock, you're like not really feeling well, you text or call me. If you're my patient, I'm the one who answers the text or the call. If you're Dr. Sherry's patient, same thing.
Yeah.
But the idea is it's not so like, okay, well, I can't see you until, Tuesday of next week. And then,
Because when you got a yeast infection, that is too long.
right, and then you get some random person at whatever practice that you went to. It's more about, hey, Colleen, I know you. This is probably what it is. I'll go ahead and send in the prescription, try it for a day or two. If it doesn't work, then it's something more sinister and you need to come in. Because the idea is, we've changed the model of how we practice, right? So we don't make money volume based, meaning we don't make money when patients come through the door. That if I see 30 patients, that's the 30 patients that I made money on, right? That's the traditional system.
Yeah.
And by the way, that is why you have to be seen in person each and every time, because otherwise the practice can't submit insurance claims for that visit and they don't get
We're
paid.
incentivized to keep you sick. 'Cause
Right.
That means you
Oh
have to
my
keep.
God.
You have to keep coming in, right?
Crazy.
Yeah.
And
Explains a lot, though.
yep.
Yeah.
But in our model of care where it's a membership based, I'm getting paid regardless, right? That's what's sustaining the practice because I'm getting a monthly amount each month. So I get to keep the lights open. I get to have the tests available here, the personnel available here, equipment available here, and myself available here.
Which I love how just transparent you guys were with that.
Yeah.
Because like I think from the medical field, a lot of us non-medical people, we don't see that transparency, and we are
Yeah,
like,
yeah.
all right, fine. If you're not going through insurance, how are you getting paid? Because we all gotta make a buck, and there's nothing wrong with making money.
Yeah.
I've said that before. Nothing wrong with that, right? So I love how transparent you are with that. So
Yeah.
like if you come in, this is what's going on. They really do care. I want to talk about two things before we get ready to wrap up and stuff. And one is I want to know and talk about doctors right now suffering with suicidal thoughts, suffering with this, and I keep forgetting what it is, my learning disabilities, moral injury.
Moral injury.
Like, let's talk to them if they're watching on camera right now. Like, are there other people, other doctors like you trying to this new method? And like, what does that look like? And how do we help foster, how do we help doctors, right? Because you guys help us so much. And if you're suffering with this moral injury, like I now have a heart, I want to help, right? So what does that look like?
Well, and think of it a lot like PTSD, that we come alongside someone, and gladly at like the lowest points in their life, often the most traumatic, painful parts of their life, and we're alongside them, but it's like being in a battlefield, all of us, of you're seeing death all around you, you're seeing injury all around you.
Especially last year.
With COVID, that it was so hard of keeping a loved one away, or being with someone, and that there's nothing that you can do, and watching them die, and all you can do is hold their hand and kind of be there with them.
And then you're in this system of, the traditional system that
Yeah.
we've talked about, how shackled, us as doctors, and this is us speaking to the doctors now, that we feel. Because, I guess, the question would be from the layman that, well, why are you guys feeling moral injury? What's up with that sort of thing? Well, Well, think about it. You spend more than a decade of your life in school. You spend all your 20s pretty much, right? If not more. If your second career, you spend more of your 20s and your 30s in it. You have insurmountable loans because loans have only gotten higher, and physician salaries actually have not increased in the last 2 decades.
It blows my mind.
Yep.
Yeah.
So now you come out of your training, you have insurmountable loans. Now you have a family, you have kids, you have a house. You're on this treadmill where you've got to pay bills now, right? And you cannot get off of it. Hospitals and these private equity firms that buy out these practices that you're now employed in, they have a non-compete clause too.
Ugh.
So if you ever want to leave, you can't practice in an X amount of radius in your area. So that means you're ball and chained. Meaning if you ever wanted to leave somewhere, it's not as easy. Not to mention, when you want to get hired by another facility, it's not like any other job. You actually have 3 months to wait before they credential you to be able to start work.
Oh my
But they can
gosh,
fire you on the spot.
No way.
Yep.
Yes.
So you are on this treadmill.
kinda caught.
You're caught. You're stuck. You want to help people. You went into this to help people. You are shackled because you have all of this debt to pay off, all of this family to support. You want to do something on your own, but you just don't have the resources, and
Yeah.
you feel backed up in a corner.
Yeah.
And that's the whole point of why this whole direct primary care movement started. Our model is direct primary care. We're not some geniuses that came up with it on our own. We thought about it, the light bulb went off on our own, we researched, and then we realized somebody has already started doing it.
Okay.
And there's 1,000 practices across the United States that are now doing it, and it's born out of that moral injury that enough. We cannot keep doing this to
Yeah.
ourselves, and we cannot keep doing that to our patients.
Yeah, because if the people who are supposed to help and heal us
Yeah.
are sick themselves, like,
Yeah.
where are we going at with this society? So, if there's other doctors out there, physicians out there who are interested, can they reach out to talk to you?
Oh, absolutely.
yeah.
We have a whole community of physicians. We call ourselves Direct Primary Care Alliance.
Okay.
And like I said, we're no geniuses. We have a whole lot of mentors that have led us to where we are now, and they deserve that credit as well. But if you've never heard about the model and you're thinking of trying to, get out of the traditional system to really actually help people, please reach out to us. We're more than happy to get you connected, talk to you. And also, if you have not heard of Z-Dog MD, he is a great advocate for physicians everywhere.
Oh, cool.
Yeah.
Okay.
He talks about moral injury. He talks about, filtering out the misinformation out there, support to the doctors and healthcare professionals. Z-Dog MD, look him up.
Awesome.
Yeah.
So, quick side question too. Do you guys offer anything that, like, small businesses who don't offer health insurance could, like, partner with you guys and, like, offer your services, like they help pay for it or something like that?
That's actually a great question. That is our next move. We've actually gotten a couple of employers on board already.
Cool.
But it's exactly that it's an employer-sponsored subscription. So a small business would pay that for their employees, and they get the same benefits as anybody else would.
I stinking love that because if you stop and you look at where a lot of small businesses struggle, they either struggle to hire, they struggle to scale.
Yep.
It's insurance.
Yeah.
Well,
They
we're not
can't
insurance,
afford.
though.
Right. But
Yeah,
what I'm
yeah,
saying
yeah.
is they can't afford
Yep.
insurance, and when people are looking to work, they need to make sure if something happens to their body,
Right.
like this circles all the way back to this is one of the most important things, right? That has become corrupt. That we've got
Yeah.
two amazing people here trying to say enough's enough. People can't hire people because they need the insurance, right? And you guys are saying enough with insurance. To the side, small businesses come, let's talk. Individuals come, let's talk. Let's get you healthy in a way that it's you and us right here. You know?
And it's the concept of, back in the day, health insurance was just that. Health insurance, just like house insurance or car insurance is. You don't use it on a daily basis, right? You use your home insurance if a tree falls off of your roof.
Right.
Otherwise, with HVAC, plumbing, electricity, you pay out of pocket. And that's what keeps things competitive.
Yeah.
So it was like that with health insurance too, where you needed it for surgeries or chemotherapy or trauma, motor vehicle accidents, things like that. But statistically, how much of that actually happens
Right.
versus what you need as a daily care?
Right.
The daily care is where we come in.
That's us.
And if we can make that affordable, then hopefully you won't actually need hospitalizations and all that good jazz.
Yeah. Just needed fluids instead of going to the emergency room and a couple
But
$1,000 later.
And things happen. God forbid you get diagnosed with cancer and, some things like that. And that's when health insurance is very important. Don't get me wrong. We need some sort of a catastrophic coverage.
I
Right?
agree. That's why we said at the beginning, it's not about pointing fingers, right? It's
Right.
not about that. And my little sister's actually in nursing school right now to be a nurse, and she had a blast. She did a surgical thing with a heart the
Yeah.
other day for one of her little,
Yeah.
I don't know what it's called, rounds, practices,
Yeah, sure.
whatever. And I appreciate everybody out there who does that. I just see this as a way to really help the me's, the us's, right? The people out there who are struggling and really need you guys and need an open communication to their doctors, right? So, okay, this is the final big question I want to ask you guys, and don't rush through it, because I think if we would just remember at the end of the day, they went into this industry to help and to heal, right? There's a love there for that. So, tell me why. Tell me what was your moment of knowing you wanted to do this, and it's kind of like what you're finding the fantastic with it.
Yeah, you know, and that I don't want to get like all preachy or anything, but for me, that it just feels like a part of who I am with my faith. Of I really, and it sounds kind of quirky, like to be God's hands in the world, to use me to heal people,
Love
to
that.
help people, you know, and just like use me. I'm here. Like you put this in my heart to help someone, and this is my gift of being able to help, and that. You know, I want to find a way to do that, and a way to do that is like attainable for people, that
Love
they
it.
can reach it, you know, instead of like, oh, I'm out here for all those folks that have the big fancy plan or have
Yeah.
the money or whatever.
Yeah.
No, I want to be here for everyone and
Love that.
do what we can, you know.
Yeah, I was a little different in the sense. She has always wanted to be a doctor. She's one of those,
Since I was
cliches
probably
where
like
you know,
10.
yeah,
Wow, good for you.
Yeah.
My realization actually came a lot later in life. So it was a very deliberate choice for me. And I was a clinical laboratory scientist before of this. I did that.
Fancy.
It sounds fancier than it actually is, but then one day, and I remember this very thoroughly too. One day I walked in and there's like 1,000 maybe samples in front of me that I had to process or whatever, and it came to me that this cannot be it. This cannot be my life.
Yeah.
And I've always been a person that has liked, touching people in a way where it's tangible, like she said, that, makes a difference in a tangible way. And so the only natural progression to that was, okay, well, I can be a doctor and do it. And that was honestly, I always say this, and this is not to sound some, hoity-toity person, but becoming a doctor was just the beginning, meaning it's the
love
stepping
that.
stone. Because the things I want to do, the legacy that I want to leave behind, and the things that I want to do to be able to change the world in a way required me to be a doctor. And that's just my path. It
You're right,
doesn't
that's
mean
your
that
path.
you have,
Yeah.
So I see it as a beginning, not as a, the ultimate, the penultimate of it all or anything.
I love
Yeah,
that.
so-
I love that for both
know,
you guys. Like
yeah.
both your all's answers is so, and we talk about this on Finding the Fantastic, its own unique, diverse beauty in every individual, right? Everybody's got their why. Everybody's got their Finding the Fantastic, and it's finding ways to implement your why in a way that changes the world, right?
Yeah.
Like you're saying, you are God's hands to help people, right? How beautiful is that? And you found your avenue to do that. You're like, this is not all that it is. I want to help. I see thousands of things in front of me, but there's more that can be done. And I know being a doctor is a step to go do that more.
Yeah.
And now you guys got to practice. That is a step to do more, right? And ultimately it's to help love on people, right? And heal
Yeah,
people.
exactly.
Which I love, because with Finding the Fantastic, that's what we're all about. And I urge you guys, if you're in the area, or honestly not even in the area, if you're curious, ring them up, email them, honestly stop by in Sterling, talk to them, especially if you're having thoughts, if you've got things, and this is something I would do where you're like, yeah, it's probably not right, but I really don't want to go see a doctor, maybe swing by, and talk to them, and just be like, hey, just saw the video, what is that, right? Or what's going on inside? And it's just start, right? Because we're so busy in trying to improve our careers. We're so busy trying to make money. We're so busy trying to check the stereotypical boxes of life that we stop to forget that above all, we have to take care of ourselves, whether that's physical or mental, right? Because that's how you change the world. And we're here to change the world, which is possible.
Yeah.
So thanks guys for being
Yeah,
on the
love
video
to.
and the things, and
And just one last thing.
go for it.
It's to what you were saying that, hey, to just come by and talk to us. We actually do free meet and greets. So you guys can actually
Come on
schedule in and talk to us as to what we're doing here, if we're a good fit for you, what kind of problems you have, and then would we be able to help you out. And it's no charge. We spend about 30 minutes with you guys.
Oh my gosh.
Go ahead and put yourself on the schedule. We're happy to see you.
When is it? Like, when do you guys do the meet and greets?
Anytime when we can fit them in.
Just
Yeah.
call our
Oh,
office.
so just call up and say, hey,
Yeah,
I want to
say,
do a meet
hey.
and greet.
Yeah.
Yep.
Yeah.
Sweet.
Yeah.
Is there anything you want to say? I always ask somebody to say something to the people listening. is there anything you want to leave with somebody? Like, just to say to somebody on the camera right now who's watching?
Just that people are out there that care about you, care about humanity, the world, of that, you know, our goal is to see you, you know, again, that we're not looking at all of the things. Sure, if there's a way that I can help you fix those, but I want to see you, you know, and have that relationship with you. It's really at the heart of what we want to do, and I hope that all of us, even outside of like our profession, just to see each other, you know, of that person on the street or that person who's struggling, of really seeing each other, being human with each other again, you know?
Just being more kinder, more understanding, more forgiving, giving people the benefit of the doubt. And that's pretty much what I, you know, kind of say to my patients too, whenever I do meet and greets, that I don't claim to be able to wave a magic wand and fix all your problems. I can't promise that. I'm no God. I have humility. I know what I don't know. And I'm not going to diagnose you with something magical where all of your problems are fixed then. But what I can promise you every single day is that I'll be a compassionate and caring physician. That I will promise every single day of my life. So that is where that's and really that is it, right? That's what anybody can do. It's you put your best out there, and that your best is all you can do.
Yep. Yeah. I love that. So with that, we're going to say thanks for tuning in. Share the video if you like it. We're going to put it on the podcast. Share the podcast if you like what you heard. And as I say always, listen, you matter, okay? You're important. And if you don't think you matter right now and you're sitting in a car having thoughts about what the point is of your life, just realize you do matter. And there's a point to it. And sometimes you just got to work through it. So message me if you need to talk. With that, we're going to leave, right?
Absolutely.
All right.
Bye, guys. See ya.
Bye.